I think I've been searching for something that would renew my hope that we're not facing the impossible, that we can sort of impact the social determinants of health, and that we can increase awareness about the problems that we're facing.
I think that the women who fought fights, who really put themselves on the line for the right to reproductive health care and all of that stuff, I think that we have a great responsibility to keep moving forward. And it's really about recognizing what no longer is serving us socially and how it affects our health.
Being a new immigrant woman and also an internationally trained physician, I found that I could support women like me, especially new immigrant professional women who are struggling to integrate into the Canadian system.
I've heard from my community, which is the Black community, that people want to not only get service that's culturally sensitive, but they also want to feel that there's somebody who not only, they can identify with what they're saying, but they can identify with the person culturally.
I think the overall hope is that women become more educated about their health, and more importantly, how they can affect not only their health, their well-being, but how they can impact those around them and how women can affect change.
ECHO, Improving Women's Health in Ontario, and the Ontario Women's Health Network partnered to develop the Ontario Women's Health Leadership Program in order to address the health inequities of the diverse women of Ontario. The program seeks to increase the ability of women from across Ontario to work more effectively in their efforts to strengthen health services and community-based care. Participants leave the program with a greater understanding of how to use sex and gender-based analysis, and with the leadership tools, skills, and networks needed for working to improve women's health in Ontario.
My thing that I really, really like about the retreat was the gender analysis, because I didn't have that much experience before how we can use this concept to improve our programming and our projects. I clarify in my mind and in my ideas the commitments of leadership, and that all of us, we can have different roles.
Gender-based analysis was something new to me, and the exercises that we did really created just open thought.
As the program goes on and more women are involved and their experiences are shared, there's a network of women who are connected with one another, and the fabric and the connection and the ripples go forward, so that there is a competency and a comfort and a confidence around having conversations about women's health at a community level that I don't think there is anymore.
Counseling typically for the everyday person is out of reach, so I've developed a program that allows women to get valuable counseling through bartering. So payment is not financial. We look at the woman's strengths and skills, and we've just started in, and it's been going quite well.
We're actually beginning our new volunteer training program today, and have volunteer coordinators from 2 external hospices taking our training program, so that they can take back the knowledge that they gain to their own hospices. This seed, in fact, was planted with the Women's Health Leadership Program.
I found it very inspiring to hear all of the different backgrounds of the participants, as well as the accomplishments that they had been able to facilitate throughout their whole lives. And one thing that was amazing for me was that I was able to feel as if I actually was a powerful woman and making a change in our community, whereas before I don't know if I necessarily would have used the word powerful when describing myself, but after leaving the 2 trainings that I've participated in, I very much feel that way.
To be with a group of women in that safe place, I think it really encouraged my heart to follow my vision.
We have a long way to go still. We have come a certain distance, and I believe bring increased understanding to our communities by working together. And I see the Women's Health Leadership Program as really enabling, illuminating, and empowering our abilities to be effective across the communities we serve.